Pharmacology, Exam 3. This is a lecture on nitric oxide. Starting off, understanding that nitric oxide has a lot of effects in the body. Nitric oxide can act as a vasodilator. It can be involved in inflammation, as well as the immune system, and it even has neuronal function. So nitric oxide is all over the place, does a lot of things. Typically, you're going to find it from 3 different cells or sources and in 3 different forms. Generally, I probably didn't word that perfectly, but there is some found in neurons, some found in inflammatory cells, macrophages, and there's some found in endothelial cells. So the NOS that is found within neurons is called N-NOS, or NOS1. And that's nice because N, neuron, and NOS. The NOS that's found in macrophages is involved, or I guess I should go back here. Sorry, this N-NOS also is triggered by calcium. E-NOS is also triggered by calcium. But I-NOS is triggered by inflammation. And it's found in macrophages. So you think of a macrophage, you think of inflammation. So I-NOS, inflammation, and macrophages. Lastly, E-NOS, or NOS3. This would be NOS2, this would be NOS3. E-NOS is found in the endothelium. E for endothelium. And it is also stimulated by calcium. So nitric oxide, when it gets into the body, is going to bind in several different places. There's 3 general categories. It can bind to metalloproteinases, it can bind to thiols, or it can bind to tyrosine. If it binds to metalloproteinases, hemoglobin, this is an example, that's going to increase cyclic GMP. If it binds to thiols, that is going to, there's 3 things here that involve this. One is that it can activate the HRAS receptors, I believe they're receptors or some sort of intermediate step, that's going to cause cell proliferation. Or, I guess also the thiol, if NOS binds to the thiols, nitric oxide binds to thiols, it can inhibit G3P, which is one of the steps in the breaking down of glucose. So it breaks this down, or excuse me, actually it inhibits the dehydrogenase. So yeah, it inhibits the breaking down of glucose. It's like glutathione 3 phosphodiesterase or something, I can't remember what it is. Then lastly, it is involved with glutathione, which is going to increase the likelihood of diabetes. And it seems like those 2 are related to me. And when it binds to proteins, by the way, it's a covalent bond. I should have mentioned that. So also it can bind to tyrosine. And I guess when it binds to tyrosine, this is associated with superoxide, and it creates these unstable molecules, the ONOO. So hopefully that's a way to remember those. So those are the things that it binds to. Now let's talk about some of the things that it does in the body in a little more detail. I mentioned earlier that it can cause vasodilation, inflammation, involve the immune system, and the neuronal system as well. So let's start one at a time here. Cardiovascular system. I probably should have done this one in red, but I didn't. So I'm just going to draw a heart up here so you're thinking of the cardiovascular system. So nitric oxide is hypotensive. That means that when nitric oxide comes in contact with your blood vessels, that it causes them to expand, okay? Which is going to decrease the tension in your cardiovascular system. So hypotensive. So I'm going to draw a big circle here for a expanding blood vessel. See, it's expanding there. And it is also anti-atherogenic. So I believe what this has to do with is either approach it this way. Angiogenesis is the making of new blood vessels, so angiogenesis blood vessels. But atherosclerosis is like a cardiovascular disease, which is where you essentially get these sclerotic plaques in the inside of your blood vessels, and it can lead to a lot of problems. And so it's cardiovascular disease. So this is anti-atherogenic. So what that means is that it decreases this process. One of the steps in atherosclerosis a lot of times is these low-density lipoproteins will get stuck on the side of your blood vessel, and then your white blood cells will come along and start attacking them, eat them, turn into these foam cells, and you get this big pussy thing along the side of your blood vessel. So apparently this is anti-atherogenic in that it decreases white blood cell adhesion. So the white blood cell may have a harder time sticking onto the sides of the blood vessels. Also, it decreases or inhibits thrombosis. Makes sense too. So thrombus is basically when you have a, like a bunch of clotting factors that are coming together and they make this big, like this clot, and then this clot can go through your bloodstream and clog things up. So then it also decreases angiogenesis. I think it's mentioned in the reading that it particularly decreased the movement of the smooth muscle cells to go to a new area, which is, I guess, part of angiogenesis. So those are the cardiovascular effects. So it looks like it has pretty favorable cardiovascular effects. So now, septic shock. What does it have to do with septic shock? Well, nitric oxide, apparently, when you get a gram-negative infection in your body, that is going to increase the amount of iNOS. Remember, iNOS was the one associated with macrophages and inflammation. I for inflammation, iNOS. It increases the iNOS, which somehow increases the amount of urination that takes place. I don't understand exactly how that works. That's what it said in the text, as far as I can understand. Another thing is that you have a lot of different, there's a lot of different pharmacological agents which influence nitric oxide in different ways. Some of them, give you more nitric oxide, some trigger the release, some of them, increase the biosynthesis of it, all these different ways of infecting. One of the ways that pharmacological agents can affect nitric oxide is that they can scavenge them. In other words, if they come across nitric oxide, they'll kind of take them, okay? Methylene blue and L-N-MMA and heme are all things that scavenge or take out nitric oxide. Well, if you're taking out the nitric oxide, that's going to decrease the vasodilation, right? Because nitric oxide causes vasodilation. So you get rid of the nitric oxide, it's going to make those things more narrow. So here's this, and it's vasoconstricting essentially. So what it does is it decreases septic shock. So methylene blue, the scavengers, and L-N-MMA, and heme, they get rid of the nitrous oxide, they use it up or whatever, they take it somehow, and that decreases you getting septic shock. Now moving on to inflammation. So first of all, this is involved in inflammation in that, I guess the first thing you mentioned on here is that nitric oxide does have some bactericidal properties. How does it have bactericidal means that it kills bacteria. How does it have those properties? Well, ONOO, the unstable molecule, whatever, is something that is used to kill bacteria if it gets in contact with bacteria. I believe it's used by our cells, our immune system. So in that case, nitric oxide, since it's involved in making of that, has bactericidal properties. It also apparently forms peroxynitrate, which I think, maybe that's, I don't know how those related, to be honest with you, but apparently that's also has something to do with the immune system or the inflammation. iNOS improves inflammation. So when you think of think of improves. Now after reading through this, the word that he used in here was improves and worsens. So normally I would think of improving as in your situation getting better, but you could also think of improving as in it increases, So I'm not sure. I believe this would be, I would assume the iNOS to mean that either it improves inflammation as in makes more inflammation, or it improves the inflammation as in makes the inflammation go away if it's a bad thing. But I'm not sure exactly what he means by that. It's something to look into, what exactly he means by the word improves, because it didn't seem to really clarify in the text that I can find. Whereas L-arginine worsens inflammation, okay, worsens. You can also think of the word aggravates. Aggravates kind of looks a little bit like arginine. L-arginine. So you can think aggravates, L-arginine aggravates, and I for improves. INOS improves inflammation. Next, nitric oxide stimulates inflammation through COX-2 activation. If you remember the cascade for making prostaglandins, there is something called cyclooxygenase. Cyclooxygenase is a necessary step in making what becomes prostaglandin D, prostaglandin I, prostaglandin E, thromboxane E2, all these different things that can decrease or increase inflammation in different ways. So in this case, it stimulates inflammation through COX-2 activation. So cyclooxygenase 2, which is something that apparently Selexicog specifically interacts with, they both influence this. So also it increases white blood cell pathogen response. So in other words, when you have a pathogen in your body, your white blood cells normally are going to respond, but if you have nitrous oxide, that response is going to be even greater to the pathogens of your white blood cells. So that's a good thing. If you were to give somebody some nitrous oxide if they were sick, apparently their white blood cells would have a bigger response. Next, it also has central nervous system and peripheral nervous system influences. Apparently, nitrous oxide is a neurotransmitter. It modulates ligand-gated receptors. It can flow retrograde. Normally when you have a neuronal synapse, it's like this, whatever. So the little things release whatever the synapse in here, but apparently if you give someone, or I guess they have nitrous oxide in here, it can actually, rather than working this way, it can go back up and influence this side of the equation more somehow. I don't know exactly what they mean by that, particularly, but that's my best guess, that it works retrograde, works backwards. eNOS, remember E is the one associated with the endothelium. Apparently, normally we would think of the CNS having nNOS, and that's normally the case. Normally nNOS, neuronal nitrous oxide, whatever, is going to be the one that's involved in the CNS stuff, but apparently sometimes eNOS is too, and so that's one of the reasons why it's hard to make really specific drugs for this, because mostly it's nNOS, but sometimes it's also eNOS. And then in the peripheral nervous system, nitrous oxide mediates gastrointestinal neurons that are non-adrenergic or non-cholinergic. So it has effect on that, nitrous oxide with the GI system. Lastly, respiratory. How does it affect the respiratory system? It increases the cardiopulmonary function, and it is going to, apparently also, if you take it for a while, give them some nitrous oxide, their body's gonna get tolerance to it. In other words, when you first gave it to them, it had this big response, and after a while, giving it to them just doesn't do the same thing for them that it used to do, and after a while it kind of stops. So it's a more of a short time thing, so it's not used chronically because of this tolerance effect. A lot of times they'll put a little bit of nitrous oxide apparently in when they're giving patients oxygen. And I know that it's also used in the case of ARDS, which is acute respiratory distress syndrome. So apparently this works well with little kids who have acute respiratory distress syndrome. Lastly, in my last minute here, just want to make a connection. I was kind of realizing, inflammation, well, that's probably going to be INOS, huh? Okay. Septic shock, if it has to do with endothelial cells, then it's probably going to have to do with eNOS, but if it has to do with inflammation, septic shock, it probably have to do with INOS. So I'm going to guess INOS, if it's coming from macrophage, and eNOS, if it's coming from endothelium. And then cardiovascular, this is going to be mostly endothelial cells. So for this, I would probably say eNOS here. CNS is mostly going to be nNOS. And I would guess again that this probably has more to do with endothelial. And this is me guessing. I'm not sure about this stuff, but it's the end of the video.